Department of Pediatrics and Neonatology, AIMS New Delhi, to deliver his presidential address. Dr. Paul has contributed to India's national programs, including reproductive and child health and nutrition. He is a visiting professor at Public Health Foundation of India. He is a well-known researcher and public health exponent. He has over 350 publications to his credit and is a recipient of prestigious Dr. B.R. Ambedkar Centenary Award for Excellence in Biomedical Research by ICMR and Public Health Champions Award by WHO. Dr. Vinod Paul, sir.
Namaste. Good evening. Most respected Madam Shashivani ji, Dr. Socorro de Leon Mendoza ji, Dr. Nina Rana, distinguished Dr. Kharot Sahab, Dr. Parag Dagli ji, Dr. Jatin Mistry ji, Madam Shobna Gupta, and the leadership of neonatology in the country, leaders, pioneers of kangaroo mother care in our country and in other nations who have graced us, whose representatives have graced us today here. My very distinguished colleagues, students, residents, and friends. It's a true honor to be here at a very warm invite from my mentor, Dr. Bani, to be present here at the second regional conference of Asia Oceania network of KMC, and a special welcome to Ma'am President, being hosted by Kangaroo Mother Care Foundation of India, established by Madam. I'm very pleased to welcome the delegates from other friends and other nations, team from Vietnam, team from Philippines, Norway, Canada, US, Mongolia, Nepal. Very warm welcome on behalf of the Government of India. I'm feeling truly at home after a long time, and therefore, friends, thank you for making it possible. I get that good old warmth. I find myself in kangaroo position, and therefore very kind that you all turned up, and you are here, and your presence is very heartening, all of you. Kumada ma'am, all of you. If I name, my fear is I leave somebody out, and that's something I don't want to do. But there are stalwarts of KMC in particular. Rekha Udani ma'am, you are there. Of course, Somashekhar, you have done so much of work, and others. I'm being cautious of not naming, although I have a great temptation to name each one of you. But first, my big salute, tribute, and affectionate submission to Madam Bani. Ma'am has changed the face of newborn health in a very special way for India and influenced this across other countries. Ma'am, we are so very proud. What you have done is phenomenal. I distinctly remember not long ago, just about 35 years ago, she developed a special affection for me very early. It was love at first sight. She invited me way back, I think in 88 was my first visit to Madam's unit, and she was at it already. 80, 88, 89, remember, you started that process. There were many questions, but ma'am believed in the intervention, and then she nurtured it, she honed it, and she created the Indian model, which we all are so proud to have embraced and followed in the footsteps of ma'am. But it was her confidence and her commitment, and to take the difficult path of, moving from proof of principle, moving from, how to start doing it, and then taking it all the way through research, through demonstration, through adaptation to where KMC in India stands today. So you've been my student, ma'am, you're my mentor. And this journey of Madam reminds me of what Swami Vivekananda, the sage whom we adore, said as a philosophy. And I quote, great example of what he stated and how, ma'am, you made it possible. He said, and I quote, take up one idea, make that one idea your life, think of it, dream of it, live on that idea. Let the brain, muscles, nerves, every part of your body be full of that idea and just leave every other idea alone. This is the way to success, unquote. Power of pursuing one great game-changing, society-changing idea. Ma'am, I salute to you. And I'm going to do something without her permission. So I'm going to join by Thank you, ma'am. Thank you. Our good wishes, our prayers for so much more work to come from you, ma'am. Friends, as we meet here today, we have a very special context. And KMC fits into that context in its own way. First and foremost, we have the context of being gathered here after a terrible three-year phase of pandemic. We are proud that we were Corona warriors, all of us in a way, the health profession, pediatricians, neonatologists, each one of us, policy enablers, and so on. And we learned several lessons. Among them, we learned the lesson that health systems have to be strong and resilient to be able to make a difference. Our capacity for preparing, developing, testing countermeasures has to be strong. Our epidemiological principles, disease control principles have to be strongly embedded in our system and expertise. There's a lot that can be stated in that context, but remember, just remember, if India did not produce 2.2 or 2.3 billion doses of vaccine on its soil, there simply wasn't enough vaccine, not enough. There wasn't any vaccine to be offered to us. There simply wasn't that level of production anywhere to give vaccine to 1.4 billion people of India. We have to be on our own. So it's a big lesson. Such a large population cannot be served on products, solutions, interventions that are not mastered by us. The total doses, let me elaborate, the total doses that we were offered of vaccines in late July, August 2021. Before that, zero. Were enough to vaccinate 90 million people. Looks big, but that's 9 crore. And that's the population perhaps which from Delhi, circle of 50 kilometers, 60 kilometers would cover. Imagine if we didn't have the capacity to develop as well as to produce in on large scale the vaccine, the ventilators, the PPEs, and so on. The short point is when it will matter, we have to be on our own. Therefore, pledge to make India's health system strong in every possible way, and above all, for the care of children. The second context, the Honorable Prime Minister has given a call, and the nation has accepted that call, that by the year 2047, when we celebrate 100 years of our independence, we shall be a developed nation. We shall be an economy currently of $3 trillion. At that time, we'll be an economy of $30 trillion, if not more. We know we can do it. This is not a trivial statement. It's a well thought out statement coming from the apex think tank of the government of India that I represent here. We will be there. If we have to be there, then our health system has to be as good as what the developed nations have. Now, that's a challenge for us. Every day that we now work and serve, please think how this generation, our generation, we will make sure that during the Amrit Kal of these 25 years, we strengthen the health system, we improve the quality of health system, and we ensure that the services are delivered at saturation level. That reminds us of the SDG theme, leave no one behind, 100% coverage with high quality. So we need to recommit to this, all of us, the senior ones. Murki Saab, now you are senior, tum to bacche the, and all of us. So I want to remind us the perspective through which our action, our work should now emanate together has to be seen through that filter. We cannot allow that goal not to be achieved. And then, because I believe health is an enabler of development and well-being and welfare and higher pursuits of a society, we have to achieve that status by 2040 or 2035, not in 47. We are enabler. We are going to push the nation to that level, and health being an enabler, we have to work doubly hard in our sector. And that's something that I would like to remind all of us. It's about then neonatal mortality rate of say 4 or 3. That's what Norway is, for example, just as an example, and so on. The third context en route to that is the SDG goal, which is not too far. We shall not forget the SDG commitments to be achieved by the year 2030, which is something that we have signed up to. India should strive in the health sector not only to achieve those indicators, but excel them. As the Prime Minister has told the nation to eliminate TB by 2025 and not the global goal of 2030. And likewise, Shobna, not 12 NMR, but below 10. That's our goal, conscious goal that we decided that we will better than the SDG average. So we should think like this. I urge that that's the context that we cannot ignore. It's a reminder. For 3 years, we were all managing our affairs in a very different way, but let's not forget these 3 important contexts. The fourth one is that in the last 9 years, health sector has transformed itself. Health sector has new energies, new ways, and systemic approach to overall strengthening of health system is visible to you. Now, I'll make that case how it is so. Very briefly, health spending per capita by the government has risen from about 1,000 rupees to 1,800 rupees. 71% increase. It shows the path. There's so much more to be done, but this much has happened. Out-of-pocket expense in 2013-14 was 64%. It is down to 48%. NMR was 26 down to 20. And we are on track, I'm happy to say, and I'm going to return to this very briefly and very shortly after I try to project the big picture. That's my job. We are on track for SDG, for NMR and under 5 mortality. We'll be there. But the issue is, can we have most of the states achieving that? That's the issue. Most of the districts achieving it, so that there's equity. We'll come back to that. The number of government medical colleges, just a few things. I'm not going full course on this one, but Number of government medical colleges have doubled since 14. We were 181. Today, we are more than 300. Okay? Double, more than double actually. PG seats from 32,000 are 68,000. This concerns us. So we have a job to do here. Undergraduate MBBS seats have more than double, from 52,000 to 108,000. This is all step-by-step hard work, policy shifts. We have a National Medical Commission bill, we have the new National Nursing Council bill, and so on. And you have the Allied Health Professional bill. I can go on, but I have to make a few points that are relevant to us. But I do want to mention the two flagship programs which concern us because the reference was made directly and indirectly to them. Through Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, you are aware, 50 crore people to start with are being provided ₹500,000 coverage per family per annum for about 1,400 plus packages. That includes practically everything. It includes renal transplant also, I'm happy to inform you, kidney transplant, cancer care. And thankfully, it does not include the Botox therapy. So it covers everything. Okay? It covers practically everything. State, it's delivered through a partnership with states. States put in 40% typically, center puts in 60% of the budget, and 77,000 crore rupees have been invested in this already, and the scheme has been used by as many as almost 6 crore hospitalizations have been covered. It's attacking the catastrophic expenses. It also has newborn packages, 13 of them. Basic. I did a lot of this, but I did this one in particular with the help of several of you. It has 13 packages, ROP, BERA, and of course, critical care, continuing care, intensive care, basic, specialized, and so on and so forth. So I'll probably touch on this a little later as to how to use it the way forward. But this is an aspirational, unforeseen, unheard, largest health assurance scheme of the world. $500 million to begin with, but in partnership with the states, we are now covering 670 million, 67 crore individuals, which is half of India. Help connect this to the system. Care being delivered by a partnership of private and public sector. This is only one sector now. Through this, there's only one sector. 27,000 hospitals, about 12,000 plus are in the private sector, the rest are in the government sector. The package rates are same, payment system is the same, and many of you are a part, transformative for the journey for universal health coverage. And the second one is the twin of this, the second original Ayushman Bharat announcement, which is Ayushman Bharat Health and Wellness Center, which are now being called as Ayushman Arogya Mandirs, Health and Wellness Center. Over a short period of 3 years, and despite COVID, 160,000 health and wellness centers, these mandirs have been established. 150,000 new workers have been put in place, from nil to 150,000. These are called community health officers for those who are our guests. And they are typically trained nurses, BSc honors nurses with specialized training. They are there. All of them have telemedicine facility. And the sub-centers have 14 diagnostics. The PSC ones have 23 diagnostics. There are more than 100, 105 for the small ones, and 172 free drugs to be provided to the population. Another transformative foundation of our primary health care. We are using it for the classical maternal, newborn, child, family planning, communicable disease platform, but now moving in the direction of non-communicable diseases in a big way. screening and treatment, including 3 cancers, cancer cervix, breast cancer, have to add ENT care, eye care, mental health, geriatric care, and so on. Short point, here is a new India's primary healthcare platform being developed, and our policy states that we will spend 60% of government money, government budget on primary healthcare services. So primary healthcare platform being rebuilt and re-energized, revamped, recontextualized, and secondary tertiary care hospitalization being covered through health insurance system. These are two very impressive pillars and path-breaking pillars of our health system, to which Ayushman Bharat digital mission and infrastructure mission and so on, a lot more is happening that we will be leaving it for some other day. Let me also say something that should be stated coming from public health dimension. 3 things. All our villages are now open defecation free. 110 million toilets have been built since 2014. To make the women have better life and household have a better life, 960 million, 9.6 crore, 9.6 crore, okay, it must be 96 million then. 9.6 crore gas connections have been provided to households for clean air. But the last one you may not know, that 71% of India's houses now have tap water supply. 4 years ago, this was 17%. 1.7 has now become 7.1. And by the time we complete this, we nation would have given clean water taps to additional 70 crore, 700 million individuals. That's about 16 crore. 16 crore means 160 million households to such a large population in about 5 years' time. Now, this population, to contextualize, is bigger than US plus Brazil, plus UK, and plus maybe other few countries together, tap to that kind of a population in 5 years. That's what India is capable of doing. I'm not going in the direction of our achievements in infrastructure, but the context is we are moving strongly to build a resilient, comprehensive, transformative health system. And these are just a few examples. There's a lot more that we can cover. So that's the context that I will not forget. And last but not the least is the context, coming back to the issues of the day, is the INAP context. The India Newborn Action Plan 2.0 is being shaped, is being crafted. It's a great opportunity for you to put the wish list to Shobna and her team, and we assure you it'll have your wish list as part of this, provided you're going to work hard to implement it. That's our job. And I'll come to what you guys are going to do it. So here is an opportunity to refine the newborn care approach going forward with 2030 goals. And that's another context in which KMC has a very central place. Now that takes me to where the current audience's focus has been. For the last 2 days, we are deliberating the role. I'm not going into the science of KMC. What I'm proud of about KMC is taking cue from what, Madam, you started. India's contribution for research toward KMC is a stellar example of India's capability. Just as having delivered UIP vaccines, we had the confidence we could do the COVID vaccine. The short point I'm making is we have a base, which is an academic base to solve problems, to hone problems, to create interventions, adapt interventions. And when I look back, there are heroes of KMC research and activism and community application and facility application. Several of them are sitting here. Ma'am, you did a great work in starting. Lucknow, KMU and Vishwajit's group. Just to tell, all of you to feel good. Somashekhar, such a deep work and lasting work you have done. And Murki Saab has done work in his own setting. Madam Udani and now Madam Nanavati, another center, Geeta Gachwala Center, Aurangabad, Bhopal. Great work that has been. Of course, AIMS did its own job. PGI did its own job. Puducherry, Bangalore Medical College, apart from yours, apart from Sumana, your group, Bangalore Medical College did the job. The short point I'm making is that as we went along, Indian neonatology, maternal health, academia rose to the occasion to continue to refine the model, adapt the model, look at the benefits of the model, and continue to improve. And that's why we are very proudly saying that now is the time to take the full package in full behest further on into the system, government and the private. But I salute the researchers and advocates and champions who made KMC a mainstream intervention, a universal intervention for newborn. That has happened. Other milestones, some more have to be achieved. I'll come to that very briefly just now. But I want to salute also the sponsors, such as the WHO, BMGF, and UNICEF, and NIPI and others who were helping apart from the ICMR and the government system. Reference was made when I came in to SDGs and KMC. I thought it was very thought-provoking. And the point that we now realize is KMC is not only about thermal support. KMC is not only about breastfeeding. That's what we started with. KMC is also about sepsis prevention in a big way. And that impressed me most when I became a champion. So my own work with our team, we are now realizing that it actually has an extension into the brain development. We expected that, but now we know it. That's a very different thing. That's a hypothesis. Now it is proven. And therefore, this modality of humane care, a partnership between the baby and the mother and the system and the family, has a great potential to move forward. Our trajectory toward single digit NMR will be hastened by incorporation of KMC for sure. So please, we have to move forward. So that's about SDG 3, by the way. Our SDG 4, which is about education, it incorporates supporting young children, one of the indicators, through early childhood development and care and education. And that's about brain connection. That's about the stimulus. That's about pruning at the right time. That's about ensuring that the brain is protected in that earliest phase when, like Ninaji, a lot of small babies are at risk. So KMC clearly will promote achievement of both SDG 3 and SDG 4, and perhaps there are others, but clearly I want to add SDG 4 again. Clearly, I can see that as a part of this. There has been my concern, which I have shared at other forums, and Shobna and others know it. When we are discharging our babies from our facilities, we are still doing the best job, of course, but we are still not happy fully. I'm not very happy. Our earlier concern in our lifetime, some of us, our work lifetime, was survival. And MDGs were about survival. It fitted well. India brought forth newborn focus in MDGs. Then we thought intact survival. But intactness meant that there is no IVH and there is no, HIE sequelae. We were happy with that. That's not enough. We left out two things. One, and this realization, Rajesh, and some of you, please think very carefully. A, we are not ensuring optimum nutrition. Study from my team, Shuchita, published very well, as you know, despite best efforts, these babies are not in the right trajectory. When you look at them at 6 months and 5 months, they're behind. Huge difference. best efforts. What more needs to be done by science, by biology, by interventions? Please work on that. And of course, highest level achievement for cognition, language, social development, and so on. So that these two are the frontiers that today's community and your students have to now pursue relentlessly. And use, so as you move, I charge you that please don't be happy with survival. You have proven that. You are good students of ours. You did a good job. We started, we were fumbling. We didn't know how to ventilate. And then Doug comes, Nalini, they come, they help us. Vinny Bhutani, they taught us. We went there, we saw. You all had your own mentors. Survival improved. Humane survival started to improve. We became less invasive and so on. Intact survival also improved. ROP declined. I think outcomes are much better. Severe IVH is non-issue. But nutrition, देख भी नहीं रहे, बच गए बस घर जाओ. Nutrition. A study from Himachal shows that discharged babies from our SNCUs, right? SNCUs, half of them are undernourished, not acceptable. At 4 months, 6 months, not acceptable. Shuchita's data, smaller babies, even worse. So short point is there is a disproportionate undernourishment, wasting and stunting is bad, because stunting is about productivity and so on. And wasting is, of course, something which you should try to correct. So this is not an acceptable outcome. KMC helps to correct that in a big way, so we will embrace, but I urge you all to think what more needs to be done through this approach. And I also encourage scientists to think about it, because this is really, you just look at your own data. They are simply not. Just go back and look at 10 babies, random. Nutrition outcomes are not optimal. I can imagine that there is a nutrition restriction. It takes longer time. Fair enough, we can discuss that till cows come home. But the point is we can do better. We cannot have, wasted babies at 4 months. Look, So that's one. But second, optimum development. That's about high-level cognition. That's about IQ points. That's about language skills. And our national education policy, is talking about, language to be taught, well, subjects to be taught through mother tongue and then additional language, then another addition, and so on. So we are aspiring to be fully loaded in terms of optimum cognition that is possible for every baby. And that is partly what we start with, or our kids start with, the genetic part, the initial development. But then for babies who are stressed, it's about extra effort to be made for these babies. That has to be optimum. Still have a long way to go. That higher level, beyond IVH and HIE lesions, no. It's about optimum cognition. Such a large cohort of small babies cannot be left behind. If we lose even one IQ point on the average for a cohort of 25 million babies born every year, these are 25 million IQ points less for the nation on the average, not acceptable. So we are all going to work hard to ensure that the stimulation, protection, prevention, and things that improve that, intervention, we take it in a big way, and KMC, you are there for that, and therefore we need KMC for every baby. But more, how do we then continue the right stimulus in the setting of the home, supported by the health system, because our outcomes are not optimum and complete till we handle and ensure this part as well. So please think about these two outcomes. You can look at the stories in other countries. I'm worried about what we are seeing here, and we have our own unique issues around small babies and stunting at birth, and therefore it's more complex, and the solution will have to come from us, as we have always seen. So in the list of my researchers are also researchers from Chingalput. I like to recognize them. I like to recognize Bhopal, I think I said that, Hyderabad, and so on. So big salute. In the end, let me say what, from my point of view, are the big ticket way forward items. Firstly, your opportunity for INAP should be harnessed for KMC. Now it's KMC. Make sure that we embrace this. Shobna has already promised it will be there, but we have to work hard that we ensure that we are able to give training. And this training is one-to-one, by the way. This counseling is one-to-one. It's not really, cannot be given through portals and so on. Therefore, please, NNF and others and government will think about how it refresher training, and for every nurse. And there are, a lot of nurses joining the newborn care every year. So that's one. Through that, we will promote immediate KMC, prolonged and continuous KMC, continues from the facility to home. This is what we have to ensure at saturation level with high quality. Therefore, it has to become part of home-based newborn care. It was there as much as at that time in 2011, we thought it can be embraced and included, but now we have more confidence. So many of you have shown community-based models that it works, and therefore fully loading HBNC. Second suggestion is that we should use telehealth support to provide that care. Today, that's much more possible. It wasn't possible 10 years ago or 15 years ago, and we didn't think of it 5 years ago till COVID came. And we are all using this system. Telemedicine has become a norm. Through our eSanjeevani, 180 million calls have been made till now. Every day, 200,000 providers are linked, and those health and wellness centers are linked, but so much more is also linked. A new Telemanas portal, which looks at providing counseling for mental health, sees 2,000 plus calls every day. It's only about 12 months old, 13 months old. It's 24/7, 14416 is the number. I'm telling you that these things are getting accepted, getting mainstreamed, and can we think about a KMC helpline in some ways? Maybe UNICEF, you can host it so that people can talk about it and there can be visual support as well. But surely I'm requesting that HBNC tele support should be a part. My third charge request is private sector, please, we have to work with you. We have to this is a standard of care, as Nina said. When she says standard of care, it is standard of care. She's WHO. So how can private sector not do standard of care? India's private sector, we will all do. We will all embrace it. We have to make it acceptable. We'll create that environment so that it is embraced. Otherwise, a lot of babies who deserve KMC are not there. My fourth suggestion is make KMC as a mainstream buzzword. I think that's something that India has not yet said. इसके बारे में general चर्चा हो. Even for well-educated women, say working in IT hub of Hyderabad or Bangalore or in Gurgaon, they really may not be aware of it. I'm talking about that segment in particular. Okay, rural, we are taking it through our health system, through ASHAs, through HPNC. We're covering them in our own way. But the segment of middle classes and the buzz around them, the media, the social media, TV, channel, that has really not happened. So in Colombia, and my tribute to Dr. Natali Chakra, who actually has been a guru for all of us alongside the Indian team, and great opportunities she provided. In Colombia, it's a way of life. It's accepted already. That's one thing that we should all think about, and we would need help from other stakeholders, such as the social scientists and others, and so on. Make KMC a mainstream way of life for child rearing in India. Let's talk about it. I don't have a proposal as of now, but let's work that just as we made exclusive breastfeeding as a way of life, and it has helped in a big way, we need to make KMC visible to everybody. And last but not the least is that there is work to be done by way of training and retraining. I'm reiterating that because that's the kind of thing that you and I have been doing, and it's our job because it is a skill which gets passed, and therefore a research effort for training should be instituted. And also I urge that the academics who are here, please see whether it is optimally reflected in the curriculum of nursing, BSc nursing course, A&M course, MBBS course, PGs. Can we make sure that it is there? I should have checked how it is reflected, but you all are teachers. And I'm sure pediatric and newborn teachers are very responsible. It's a matter of making sure that it's triggered, and it will happen. And therefore, please make sure that part of the curriculum of CHOs, the BSc nursing, and particularly because they are the ones who will look after babies, almost all of them in some stage or the other. It should be part of the nurse practitioner course for midwives that has been crafted. We'll have a look at this. We are starting 3 nurse practitioner programs, 6 more will come. Midwifery, critical care, and 1 more is already on. Make sure that this is plugged in there. So those of you who are in that space may please do so. In the end, I express my deep appreciation for the opportunity, for all of you for having carried this torch ahead. There are many who have not been able to come, but India has risen. India newborn fraternity, nursing, doctors have risen. We are very happy to have our distinguished guests from several nations who have graced the occasion. We will learn from you. We learned from you. Philippines was one of the most impressive examples when we were discussing how to craft a program some 15 years ago, and so on. We thank you very much for your support, and thank you very much for inviting me. I wish you strength, but I urge you that work harder in this area. We are not yet done. We still have a long way to go for 2047, but the journey already started, and it moves on a daily basis. Thank you very much, Jai Hind.
Thank you, sir. It indeed was an honor to listen to you. I now request Dr. Jatin Mistry, member KMC Foundation of India, to deliver